Hello everyone, I'm Richard Conway from Dublin, Ireland, reporting from EULAR 2021 for RheumNow. And I'm here to talk to you today about a poster that was presented in Wednesday's poster session. It was poster 0595, and it was by Dr. Atienza Matteo and colleagues. This poster was titled Abatacept in Usual and Non-Specific Interstitial Pneumonia Associated to Rheumatoid Arthritis, National Multicenter Study of 190 Patients. So I've talked about the earlier version of the study for RheumNow before, from ACR 2020. And in that study, these same authors showed in their multi-center study that Abatacept seems to be an effective treatment for rheumatoid arthritis interstitial lung disease, which was a big advance in giving us another treatment option in manifestation of rheumatoid arthritis where there really is a paucity of options that have been proven to be effective for treatment. So in this current study, there was 190 patients who had rheumatoid arthritis related interstitial lung disease. It's a multi-center observational study conducted in Spain. And all of these patients received Abatacept for the treatment of interstitial lung disease in rheumatoid arthritis. So what the authors did in this particular study is that they compared the patients who had the usual interstitial pneumonia appearance of their interstitial lung disease to the non-specific interstitial pneumonia appearance of their interstitial lung disease. And this is important. So our conception of this from outside of rheumatology, from the respiratory literature, is that patients who have a UIP phenotype, which tends to be idiopathic pulmonary fibrosis, have a very poor prognosis, generally inexorably progressive once it develops, and don't respond well to treatment. Whereas patients who have NSIP tend to respond better to treatments in general. So bringing this over then to the rheumatology space, there would, translating from the respiratory literature, there would be an understanding or a hypothesis that patients who have rheumatoid arthritis-related interstitial lung disease with a UIP phenotype are more in a fibrotic scarring process and don't have much inflammatory activity going on, may not be likely to respond to immunosuppressive therapy, whereas patients who have an NSIP phenotype may be better candidates for immunosuppressive therapy, and that overall we may think that we are more likely to be able to halt disease progression in those who have NSIP, that it's a better phenotype to have. So the results of this study within that framework are very interesting. So the authors essentially found no difference. It didn't matter whether patients had a UIP phenotype or an NSIP phenotype. They responded equally well to Abatacept. And in general, they responded well. Over the course of this study, the lung function declines as measured by PFTs essentially stopped. Patients stabilized both their DLCO and their FVC with Abatacept. So, I mean, this is still early days. This is an observational study. We really need a randomized controlled trial in this space to look at Abatacept and better establish its effect. But this is really encouraging stuff. Remember to follow me on Twitter at Richard P.A. Conway and to tune in to RheumNow for more updates from EULAR 2021.